How you doing, everybody? Dr. Dex Alvarez here with Palma, Ceia Chiropractic and Wellness Center. And I thought I would make a quick video to answer some questions because I've been getting a lot of questions here in the office about how CBD works. Something that's there's a lot of research coming out on now, and something that a lot of patients have been having a lot of success with, and some patients not really having much success with. So I've done quite a bit of research on this just because my grandfather is a heart patient. He has COPD. He survived 12 rounds of chemotherapy, has beat stage 4 lymphoma twice. And it was something that his oncologist said may be able to help him as he was moving forward in his recovery for cancer. So I jumped on and started doing quite a bit of research to be able to understand how this supplement can really help. And the way that it works is it works very heavily on different neurotransmitter receptors in your brain. So you have a system of your brain called the endocannabinoid system, which is very closely linked to your parasympathetic nervous system. So a lot of my other videos that I've put out there talks about how the parasympathetic nervous system is your rest and digest part of your nervous system. When you're in that parasympathetic state is when your body heals and is able to detox a lot as well. So that when you're using CBD, it does upregulate that portion of your brain to kind of force you into parasympathetics so that A, you can sleep better, B, you can heal, and your body has the ability to detox a lot easier. Now, CBD does have a lot of different forms, from full spectrum all the way to isolate and nanoparticle delivery. The isolate and nanoparticle delivery does have the 0 THC, which is the psychotropic part of the hemp plant. The isolate versions and the nanoparticle have 0 THC, while the full spectrum has about 0.3%. That 0.3% is only there because of the portion of the THC molecule really helps with the binding of the CBD to the neurotransmitter to the neurotransmitter receptor in your brain. So it helps it bind a lot harder so that you get more of an effect with still having no psychotropic effect. So there's different ways to utilize it, from tincture form to a vape form. Here in the office, we don't really necessarily promote the vape form just because when you are vaping and inhaling any type of something like that, it does have negative effects on your lungs. So a tincture or sublingual and a topical cream form are a very safe way to be able to utilize this supplement. To get really technical, the way that it works is when you're utilizing especially a tincture or a sublingual form, it's going to work really hard on your serotonin receptors. Serotonin is the neurotransmitter that tells your brain to shut off, fall asleep, and stay asleep. So that's how CBD helps with sleep, anti-anxiety, and anti-inflammation. It can also work on your pain receptors, neurotransmitter receptors, which is the very similar way as capsaicin works. Or if you're familiar with capsaicin, that's a anti-inflammatory and pain regulating supplement that's been used for centuries. We can use in a lot of pain patches you'll see. So that's the idea behind using a cream. So very safe to use. It's always a good idea to speak to your doctor about how to use this supplement and make sure that it doesn't have any interaction with any other medications that you may be on. But in my research and in taking a look at it, especially for use for my grandfather, it's been extremely safe, hasn't had any interactions, at least with his medications or any of the medications that I've seen with any of our patients. And it really assists in your body to be able to get into that parasympathetic state so that you're able to sleep harder, you'll be able to get into REM sleep, you'll be able to have some anti-inflammatory properties and really kind of further your body along in just an expedited healing manner. So I hope this answers some questions. If you have any questions, please feel free to shoot us a message or make an appointment here in the office and we can talk through some of the products that we offer here and how they work and make sure that they're safe for you or your family. But if you have any questions, please shoot them. I've done my reading, so I'm here to help you out. Hope you have a great rest of the day. Take care.